Dr. Banerji, thanks for joining us today.
My pleasure.
So the first news that we've been hearing that Pfizer has requested that Health Canada approve the first COVID-19 vaccine for children between the age of 5 to 11. How significant is this development?
I think it's hugely significant. Right now, that age group is a large cohort of children or people that are in a congregate setting that aren't vaccinated. So it's really important once we get that age group or the majority of those kids vaccinated, we're basically entering a different phase where the majority of Canadians will be vaccinated, including that younger population. So that means that possibly in the future, instead of having a large fifth wave, that there could be, slowly an end to this.
Oh my goodness. So that is a significant development given that. In terms of the actual vaccine itself, I guess part of the reason why it took longer than the development of the vaccine for age 12 and up is because it's not just a smaller dose of what we're seeing being used for those in that age bracket. It is different. Maybe explain that to us.
So originally it was the adult dose is 30 micrograms and the pediatric dose was going to be 10 micrograms based on studies looking at the immune response to the different doses. So they said 10 micrograms. So now what they're saying is it's slightly different. It's like adding a slightly different flavoring, an adjuvant to boost the immune system in that age group. So it's not going to be identical, but it's going to be extremely close. So therefore, Pfizer is saying you can't just dilute down the adult vaccine. You have to buy the pediatric vaccine. So I'm not sure how much of that is really marketing versus that it's going to be a more effective vaccine in that age group. But right now, what they're saying is that we want you to purchase the pediatric vaccine.
And of course, as we mentioned, Dr. Banerji, one of the key concerns here, as people are weighing, or as these federal groups are weighing whether or not it should be approved, is whether or not there are risks. And we know that when it comes to mRNA vaccines for young people, there have been rare incidents of myocarditis or inflammation of the heart muscle. So how much concern is there about that potential risk?
So it's a very rare risk, but I think that we need to continue to monitor it, especially in males, teenagers. I think 16 to 30. It seems to be fairly mild in response to anti-inflammatories like ibuprofen and things like that. So, but we need to keep track of it. I know that one of the studies said 1 in 20,000, another study said 1 in 10,000. So it's still pretty rare, but the risk of getting COVID and some of the severe side effects of COVID seem to be higher than that. So you have to do a risk assessment, and it looks like, giving the Pfizer vaccine reduces the risk not only to that child, but also that child spreading it to other children. And so you have to take all that into consideration and also look at, by getting those kids vaccinated, will it open up things for that kid, like going to sleepovers, going to the movie, going to the restaurant, etc., and normalizing our lives and reducing the risk of transmission to other family members at home, especially those who are elderly or immunocompromised.
And that's a perfect segue into my next question here. And that's because previously it was believed that children were at a reduced risk of severe illness from COVID-19. So wondering if that is still the case, as we know the virus continues to evolve. So if it is still the case, what's behind the push then to get younger kids vaccinated? Is it about protecting those within their household or those who they may come into contact with who are immunocompromised or more vulnerable?
It's a bit of both. So children do get COVID. I think last year, many parts of Canada wasn't measuring it. And now we're measuring more. So we're realizing that children do get COVID. They can spread it, and they can get a very small percentage of them get very sick. But also, it's part of the outbreak, spreading child to other people and then home, and then potentially infecting people at home who are compromised. So it's really everything, protecting that child and the community and the school and the teachers and everyone else.
Do you have any sort of best guess on the timeline when we could see something like this actually be rolled out? And what impact will that have then on the case count in the country?
So I think that I'm going to guess it's going to be within a few weeks, so possibly the end of October. And then I hope that right now, I believe that 1/3 of all the cases of COVID, at least in Ontario and Alberta, are school based. And so you're going to drop that down, and there's going to be less community spread from those kids. And so I think that if we do have further waves, like a fifth wave or going on, I think it's going to be a lot less, because then the majority of the Canadian population, like now it depends on the province, but we still have the majority. But then almost all the Canadian population will be eligible for the vaccine, and I think that we're going to get a lot. We're going to dampen down any future waves.
And very finally, I wanted to ask you, there was a new survey that was actually done by the Angus Reid Institute saying that more than half of the Canadian parents who were surveyed do plan to get their children in this age group vaccinated as soon as the vaccine gets the green light. And then on the other hand, within that same survey, it said that about a quarter of parents said that they are not going to vaccinate their elementary school age children, even if the vaccine is approved for that age group. So what advice do you have for parents who are, weighing these very real concerns?
Well, parents really want what's best for their kids. And a lot of parents are concerned because I think that this is new technology. And I think the messenger RNA technology has been around for actually a couple of decades. But I mean, we need to look at the data and try to address some of the concerns. Some of them are probably legitimate concerns. There is a small risk of myocarditis, pericarditis, but that's small. But there are things that are attributed to the vaccine, like they say that the vaccine can cause cancer or infertility, or a whole bunch of things, and that there's no biological basis for that. So some of those concerns, if we can address them, then hopefully more people will get their children vaccinated. But we understand that parents want to do what's right for their children, and some of them are a little bit cautious, and I get that.
All right. Well, thank you so much for your time on this. That is Dr. Anna Banerji in Toronto.